Hi, everyone. This is Dr. Colleen Meyer with Meyer Mints LLC, bringing you Fearless in Pink. We have an amazing, awesome guest today. And this is Dr. Andrea Liner Strachman. Did I say your last name correctly?
You did, yes.
All right. And she is a licensed clinical psychologist
Yes.
helping people with relational trauma. Welcome, Andrea. Go ahead and tell me a little bit more about relational trauma.
Yeah, so I just love helping people with relationships because I really feel like relationships are at the core of who we are and what we do. Even biologically, we are programmed to be social creatures. So the relationships that we have with, early caretakers, with our romantic partners, with our friendships, and even with ourselves, ultimately, I think dictates how our life goes. So I got very interested in relationships and couples work and worked a lot with young adults in my training years. And one of the things that was coming up a lot for people were breakups. And I was included in that. I was in graduate school from 21 to 25. So prime ages for relationships and breakups. So I was going through some of my own. I was helping clients through theirs and just started specializing in kind of what that impact can be on people and how to help people through that.
With relationship trauma, so I understand breaking up, but could it also be relationship with parents, relationship with you know friends? Because sometimes you're so close with, just even if you're just friends, that can create personality differences and some trauma. Do you see a lot of that also?
I do. And I'm being careful about using the word trauma
Okay.
because trauma is more in my psychology practice, where trauma is something that really needs to be addressed by licensed clinicians. Whereas in some of my new work, more in the coaching world, which I'll talk about later, we don't go into trauma land as much. But I always like to clarify for people, and we talk about this all day long in my field, but not everybody knows, we talk about different types of trauma. There's big T trauma and little t trauma. And it can definitely be traumatic when you are dealing with, whether it's a friendship, a parent, a boss, a coworker, or a romantic partner. If there's mistrust, betrayal, anything that kind of goes against your boundaries, things like that can be very traumatic and can start to form how you view yourself, how you view the world, and how you want to handle relationships moving forward. So there can definitely be ripple effects that we would consider to be traumas.
Let me ask you a question, because you just made me think of something. What about when someone's in a relationship, maybe they haven't broke up, but they're in a relationship with somebody that might be like narcissistic? Do you
Mhm.
see a lot of that in your coaching?
Absolutely. Absolutely. And a lot of the time, what it ends up being, I work with very high achieving, very personable, charismatic, successful people. And oftentimes when they come to me, they're like, this relationship and the effect of it on me isn't making sense based on how I am, based on how I live my life. I don't understand how I've gotten swept up into all this drama, all of this emotion, questioning myself. This was never who I was before. And more often than not, it's because they're dealing with a partner who, we hear, narcissistic tossed around a lot. And sometimes it's hard to say whether like they truly are diagnostically narcissistic, but that general vibe of that toxicity, that controlling nature, that making you question, gaslighting you on even small things like, no, you said we were meeting at 6, not 7. Oh, I did. I feel crazy now. Those
Mhm.
type of things happen all the time.
Now, gaslighting, do you want to share what that term means?
Yes, yes. So I wish I had reminded myself the specific origin. So it gets its name kind of from a movie that I think is many, many decades old now. But the concept is that gaslighting is when you purposely try to make someone misremember or misbelieve their own thoughts, memories, and beliefs. And it's a great way to chip away at someone's autonomy and sense of self. So a controlling person often will gaslight so that they can manipulate you into thinking that they're not manipulating you, that you're a problem, that you're causing it, that you're misremembering. And it can create all sorts of fractures in your sense of self and ability to trust yourself and other people.
If somebody came to you in that situation, what would you say in a broad sense, right? Because everybody's going to be a little bit different.
Right.
What kind of suggestions do you have with people? Because what I found, talking to women and actually seeing it in my own family with my oldest daughter, it's and you see it on face, like you said, it's that word that's thrown around, all around a lot. So what would you say would be some of the steps in a general term to
Yeah.
dealing with that?
Yeah. So this is where my two paths kind of converge a little bit, or
Mhm.
diverge, I should say. Converge. Where in psychology land and therapy land, it's a lot more about exploring and helping someone come to their own conclusions. Whereas in
Mhm.
coaching, it's a lot more directive. So in the therapy world, and where I got my first training was actually at the National Domestic Violence Hotline, based out of Austin, Texas, when I was in college. And we're kind of trained there that you can't just walk into someone who's clearly in an abusive situation and say, you need to leave,
Mhm.
because there has to be that level of readiness.
Mhm.
So, and if you do that prematurely, they're going to see you as a threat and they're going to cut you off and you're going to be further isolated into this bad situation. So it's this delicate dance of I often just start with asking a lot of questions. Does this relationship make you feel generally good or generally bad? Do you feel more at peace when you're with your partner or when you're away from your partner? Have you noticed any major life decisions that have strongly veered from what you've always wanted while in this relationship? What do your friends and family think about this relationship? And oftentimes people will say that, their friends don't like the partner, their parents don't like the partner, their siblings don't like the partner. And then I'll be like, well, do these people talk to each other? Well, no. Okay, so they all independently came to this conclusion. That's interesting. And okay, maybe with friends, we've got some frenemies or you've got some competition with a sibling or something. But for the most part, do these people have your best interests at heart or do they want to sabotage you? Well, I think they have my best interests at heart. Okay, well, that's something important to take account of. So kind of
And
starting on that awareness level.
because you're leading them, you're helping them to see it for themselves.
Yes,
And it is hard to tell someone to leave because I think that the moment that they leave, that's the most dangerous part of that whole
absolutely.
process of disengaging with
Yes.
the type of person.
Yeah. And we talk a lot in therapy land about meeting people where they're at, which of course is not the most grammatically sound sentence, but it makes sense that we talk about there's different stages of change. And depending on where someone is, sometimes they're in the position of there's no problem, I don't need to do anything. And sometimes they're, well, this is a bit of a problem, but I'm not going to do anything about it. Or this is a problem and I'd like to learn what my options are for doing something about it. And you kind of have to assess where someone is and meet them at that point, because if you meet them at a different point, it's not going to resonate for them.
Mm-mm, it's not. It's not. So let's go back to when you first started and going down this road of becoming a doctor, and then you in coaching. If you can go back and talk to the Andrea of that time period, what would you do differently, or what would you, if anything, and then what would you say to her?
Ah, such a good question. I've been thinking about this because we are coming up on the 10-year anniversary of when I started graduate school.
Hmm.
So all of my girlfriends from graduate school and I were talking like, oh, we've been friends for 10 years now. This is insane. And gosh, thinking back, I think the thing I would do differently is that I would have been a little more accepting of the ways that I am naturally, and my personality is naturally a little bit different than the typical psychology teachings. I was trained very traditionally, very psychoanalytically, a lot of think old school Freud stuff. So traditionally, in that way, the therapist has a blank facial expression and doesn't emote and doesn't react and is just this blank slate for projection from clients and patients. And I have a big bubbly personality. And I spent a lot of years trying to squash that a little bit to fit that mold. And then I realized, no, this is my superpower. This is why people seek me out. They don't want that, white bearded man who's not reacting to them at all. They want someone they can relate to. So I think I would have changed that. And I probably would, that's what I would tell myself, that there's room for you as you uniquely are in this field to make a difference.
I love that because I think that when we try to be somebody who we're not, people can sense that it's not real.
Yes.
And if they don't think you're real, they're not going to trust you.
Yes.
And I, to be honest, I would totally want a bubbly person than a white
Right.
bearded
Right.
gentleman with a straight face and tell me, how are you feeling about this? Because I think if you go see any coach, any doctor, whether it's MD or, or in the mental health field, therapist, whoever it is, you want to know that they care about what you're saying, that they care about your situation,
Mhm.
that they're hearing you, and
Absolutely.
yeah, and exactly. And so I think that was a two thumbs up for you on that.
Thank you
Now let's talk about, I know school, because we've both been through
so much.
a lot of education. What made you make that crazy step to get in your doctorate?
Yeah. So for me, things kind of just happened a little bit. And this is always the funny part of telling my story, that I don't know, this might not relate to a lot of people, I'm not sure, but really growing up, I was a very strange kid and I loved going to the dentist. So I always thought I wanted to be a dentist. This is probably because I didn't have a cavity until I was 30 years old. But I just, my whole life, that's just what I decided. And you know how kids can glom onto an idea. So I didn't even consider anything else. And I did kind of shift once I had braces. I wanted to be an orthodontist. So, you know, we did have some movement there. But I went to school and I started for that. And I hated it. I hate like all the science classes. I went to a huge university, University of Texas in Austin. So I had like 500-person chemistry classes that just were not getting through to me. And I was feeling like a failure all the time. And then I had kind of some, you know, social stuff going on. And I was just like, I was unhappy. And I realized that the things that were the most interesting to me were my human behavior classes, my human biology classes, things about the brain, and my psychology electives. So then I remembered, oh, there's a whole career you can make of just talking to people and learning their stories and figuring out why they do the things that they do. So I decided, and you can't really do much with a psychology undergraduate degree. So I knew I would have to do something else. So when I switched, I immediately just started looking into graduate schools and focused on ones that not less the research side and more the practicing side. So it just kind of fell into place a little bit.
But I think that's amazing because we have to follow our passion. And you're probably a lot happier now than if you were a dentist or orthodontist.
I think so.
Yeah. But let's talk about your field.
Yeah.
So let's talk about who inspired you. Was it Skinner? Or was it Freud? Was it who inspired you when you're going through school and you're learning about all these theories? Who was it?
Oh gosh. Well, I mean, obviously, a lot of great people paved the way, but there's this one psychologist that I think if anyone listening happens to go to or have gone to George Washington University's PsyD program, you can confirm for me. We are all obsessed with Nancy Mcwilliams is her name. And she is a psychodynamic psychologist based out of, I think she's in Princeton. Um, Princeton area, or I think she teaches at Rutgers, but I'm forgetting where she practices. Anyway, she has a bunch of books that we read throughout graduate school. And it was the first time that I had read or heard, and I actually got to meet her in an elevator at a conference once. I was so awkward.
Wow.
But the way she talks about psychology and therapy with people, it's like she cares so much. This is not just a sterile clinical relationship where you're in the door, out the door, and I never think about you again. She cares. The way she conceptualizes, the way she puts things together. This client mentioned this one thing about their childhood, and this thing is going on for them at 45 years old. And here's a connection that makes so much sense when she says it, but I never would have thought of.
Yes.
It's just incredible. So, Nancy, if you're listening, thank you.
Hey, wouldn't that be fun if we can get Nancy on this podcast?
Oh my gosh.
I would love that. I would be so excited.
She's fantastic.
So let's talk about let's switch a little bit with your coaching. Tell us a little bit about the coaching, your coaching
Yeah.
side of it.
So as I referenced before, there's a lot about the psychology field that I don't resonate with, and that doesn't really feel like a fit for me and my personality type. And there are a lot of rules in place for very good reason. I mean, all the rules that we have are because there were situations that arose where it was apparent those rules
That's
needed to
right.
be
I
in
believe
place.
that. Hmm.
But some of it has become so constraining over time. And I was finding that a lot of the people I was working with and the people I enjoyed working with the most, they don't necessarily meet diagnostic criteria for anything. It's not that they necessarily have major depressive disorder or generalized anxiety or trauma, but they're going through normal life things, normal life transitions that we all go through, and they're having a reaction and needing a little support. And I was finding that psychology was just a little bit too narrow for that.
Hmm.
So the coaching world, and I have my beef with coaching too, which I can talk about. But one of the wonderful things is how unregulated it is. This is also
Hmm.
a problem with it. But in coaching, you can see people from anywhere in the world. It doesn't have to be your state that you're licensed in. You can work with people on a wide variety of issues. Insurance doesn't tend to cover coaching, which does make it cost prohibitive for some people, but there's no parameters on, oh, we'll only cover this diagnosis for this many sessions. Oh, we'll only cover 20-minute sessions, not 50-minute sessions. Like, you're not dealing with any of that.
Hmm.
So coaching was a cool way when I kind of wrapped my head around it, because there's a bit of a divide, among therapists and coaches sometimes. That this is a viable option, that this is something I can do to become more accessible and impact more people on a larger scale.
You
Um,
know, that's really important what you just said, because I was doing a buyer persona for one of my clients, and it was in this similar field. And what I found in my research, that a lot of um, people that are maybe middle to lower socioeconomics,
mhm,
or people of color, are less likely to go to a psychiatrist
mhm.
because of this
Stigma.
stigma. But even though that's changing,
Yes.
that's changing for the good.
Mhm.
But there's no stigma of saying, I'm going to go see a coach.
Right.
I mean, actually, you get this, right? You get two
Yeah.
thumbs up. I got to go see a coach. Yes.
Yes.
And do you feel that that's a big shift for people to come to you because of that, the word coach rather than the word psychologist or psychiatrist or whatever they
Yes.
perceive that to be bad?
Absolutely. Absolutely. And I think there have been a lot of people mistreated by the formal mental health system. There's a fantastic person. Her name's Dr. Nicole LaPera. She's the holistic psychologist on Instagram. She has millions of followers, and a New York Times bestseller list book that recently came out. And she just recently did a thread where people were submitting stories of just the ways they had been wronged by
Uh,
traditional
Horrible.
psychologists and therapists. And I mean, it's stuff that I can't imagine how these people ever got licensed for doing these things. It hurts me. And so I can't imagine doing that to a client, even in the therapy role. But I think there are a lot of people that the coaching world just seems more accessible to them. And anything based on academia, has that kind of systemic racism issues and things, or it's mostly powerful older white people calling all the
Hmm.
shots. And coaching's kind of this new world where you can just pop on and do it. So it feels more accessible to people in that way too.
And I love that, because it gives people freedoms to say, I need help. Where do I go? And like you said, over on this side, it's very narrow. It's this, we're going to talk about this. Sometimes people are just going through a rough patch, and
Yes.
they just need to get over that patch, and then they're fine.
Yes.
You know what I mean? So, how, an emotional breakup, a death of somebody, all kinds of different things that people would come to a coach for, to help them through that. We don't want to say trauma. What do we want to say if we don't use trauma?
Struggles,
Str-
issues. Yeah.
I love that, struggles.
Yeah.
Yeah.
Yeah, and I will say, so one of the things that I'm really excited to be bringing to the table, is because I'm a certified clinic coach, which everyone's like, what the hell is that? Um, it's a new thing. That's why no one knows what it is. But in the coaching world, one of my qualms with it is how unregulated it is. That's wonderful in terms of accessibility, but it also means that there's a good chunk of the coaches out there, they literally wake up one day and decide, oh, I went through a hard time. I could probably coach people through that. And they become a coach. And there's nothing wrong with that. There are some people who are just very naturally gifted and intuitive and good with these type things, but you can't guarantee that. So the certified clinic coach designation is now a new thing that Katie Reed is a clinician who spearheads this for people who have clinical training, clinical experience, are licensed therapists, but want to break into this coaching world. So you're getting someone who has the flexibility of coaching with the knowledge and training of a formal therapist.
Well, to me, you are bringing all of this stuff. It's like this, the education, the licensing, you're bringing so much more to people. Now, when you do your sessions, do you do them, let's say somebody in Nevada,
Mhm.
and I know you're in the East Coast, right?
Colorado,
Oh, that's right. So what would that be? Central time,
mountain time.
mountain time.
Yep.
So somebody, let's pick it a different state, from Florida
Uh-huh.
or somewhere, and they want to have a session with you. You can do that no problem through Zoom, like we're talking right now.
Exactly. Exactly. And with psychology land, oftentimes I'll get people who call me and they're out of my state of licensure. So I have to say no, which is unfortunate.
But you can coach.
I can coach, yes. So that's part of why it started happening too. I was getting some requests from people in other states because I've networks in many places, and people be like,
Mhm.
you should talk to Dr. Andrea. And I'm sorry, I'm only licensed in Colorado. So that's part of the appeal.
Now, so let's say somebody wants to get a hold of you. How would they do that?
Yeah, best way is email. And that's just hello@drandrealiner.com.
I love
Instagram
that.
also. Thank you. Instagram, I'm trying to build there. I think actually, if I could go back in time to answer your first question, I would have started doing more social media stuff earlier. I
Hmm.
didn't because I was so worried what my colleagues would think about it. But the people who did start a couple years ago are making big impact now. So I'm
Hmm.
catching up. So follow me on Instagram at Dr. Andrea Liner with dots between the names. And those are the best ways to reach me.
Do you have a website they can go to?
I do. It's in progress. So right now it is just a little landing page, but it's drandrealiner.com, just drandrealiner.com. And on there you can get access to my free breakup first aid guide and be added to my email list, which I barely ever send anything out because I hate getting emails. So I promise I won't spam you.
Well, all right. Thank you, Dr. Andrea, for coming and being a guest here on Fearless in Pink. We appreciate having you on.
Thank you for having me.